When I first started to develop contextual safeguarding, I was reviewing cases where young people came to harm beyond their families, largely in peer interactions outside of the family home. And in one of those case files featured Sarah, who was 13 years old. And in her witness testimony, she stated, "If you're rude to them, then they'll beat you up. And I've seen how they beat up people, how everyone's scared of them. I said no for something very little. I've been beaten up and bottled, and I realised if I did say no, what would happen. I was pressurised and scared. I knew deep down I didn't want it because I was still young, but I didn't have a choice." And this was Sarah's description of the sexual exploitation that she experienced from peers who were all aged 13 to 15 years old over an 18-month period in her local area, largely in parks, fast food restaurants and transport hubs. In their assessments of her need, professionals described Sarah as difficult to engage with, anti-police, and someone who places her friends and gang associates as a higher importance than her family. And Sarah's mother was put on a parenting course to improve boundary setting around Sarah in order to protect her. Sarah's case was not uncommon. In fact, it reflected all the cases I reviewed at the time and the wider emerging literature on different forms of harm that occurs beyond families, whether that's sexual exploitation, criminal exploitation, peer-to-peer sexual abuse, teenage relationship abuse, a range of harms that may not be featured in a parent-carer child interpersonal relationship. And what this evidence was telling us was that extra-familial issues were presenting a risk of significant harm to the welfare of children and young people. And therefore, child protection systems and social workers in the UK were being increasingly called upon to respond. And this was happening over a kind of 15-year period. But they were working in systems that sometimes assessed and intervened with young people like Sarah, who were affected by the harm, and sometimes young people who caused that harm. Sometimes they were the same young people. They also have assessed and intervened with their parents or ended support when parents were viewed to be protective. But this meant that the peer group, schools and public spaces where that harm was occurring remained unsafe. And this applied even in cases where there were successful prosecutions. Indeed, of the 9 original cases I reviewed, 7 resulted in prosecutions of young people for criminal offences, and those young people received custodial sentences. But the wider peer groups of which they were a part, the school environments where the harm occurred, or the public spaces where it occurred, remained spaces where risks were escalating. So what we saw was that the response to the harm and the locations of the risk were misaligned. And while this misalignment was quite obvious, it was very much in keeping with the traditional reach of focus of a child protection response to harm and abuse, which is to respond to the child and wider home environment, accepting a referral for the child and their family, planning for them, following assessment and providing intervention. While our wider youth justice system, and specifically policing and community safety frameworks, arguably had a broader reach. So youth justice assessments would consider peer relationships, policing investigations would interview young people's peers, collect evidence from the school and public spaces where the harm occurred, and community safety interventions would be used to disperse young people, serve civil orders related to antisocial behaviour, and so on. So what we saw was extrafamilial harm largely being framed as a crime and justice issue, even though it presented a risk of significant harm to children and young people. So the contextual safeguarding framework was introduced to provide a resolution to this mismatch, setting out a vision for what safeguarding systems might be able to achieve in response to extrafamilial harm. First coined the term contextual safeguarding in 2015 and then converted it into a practice framework following research in local authorities in 2016. And I would stress that it is a framework, it's not a practice model, so it's going to look different when it's operationalised in different parts of the country. But wherever it's operationalised, what we're looking for are safeguarding systems that can target the contexts where this type of abuse occurs and change the social conditions that enable it. So not just see a child in the context of their school or the park where they spend their time, but actually identify the factors that facilitate abuse in those settings, assess them and intervene with them. The system needs to be able to achieve this through the lens of child protection and child So the third part of the contextual safeguarding framework requires that areas respond in partnership with those that can make a difference in the places and spaces where this type of harm occurs. So in partnership with young people, with parents and carers and wider families, residents, shop owners and shopkeepers, those that manage transport hubs, those that run schools, parks and recreation, leisure. All of these agencies become key partners in a contextual safeguarding approach. And finally, the system needs to be able to measure its impact on context as well as on individuals. So not just knowing whether an individual has been made any safer, such as Sarah, but whether the park she was exploited in is any safer, or have other children filled her place now that she has been safeguarded. And furthermore, not just measuring individual changes in Sarah's behaviour to know if she's safer. So Sarah may stop going missing from home when she was before. She may start attending school when she wasn't before, but not assuming that that means that she's safer. She may still be navigating harmful environments or experiencing exploitation outside of those behaviour changes. So this is in essence a contextual safeguarding framework. It's an approach that targets the contexts where extra-familial harm occurs to change the social conditions of abuse in those contexts through a lens of child protection and child welfare, in partnership with the people who can make a difference in those places and spaces, and measures its impact contextually. And over time, we've had to foreground the values that underpin the contextual safeguarding framework, especially ensuring that it's used in a way that's collaborative, working in partnership with young people, their parents, carers, families, and wider communities, rather than doing to them. That the approach is rights-based, engages with young people's rights to protection, their rights to have their views heard and considered, but also their rights to associate with each other and their rights to privacy, and the tensions that might emerge when we try to engage all those rights in our safeguarding practice. That the approach is used in a way that's ecological, sees young people in context of their peer groups, their families, their communities, but also sees those peer groups, families and communities in the context of wider factors such as poverty or structural harm such as racism. That the approach is strengths-based, seeks to create safety, not solely to disrupt risk, and looks for the assets within young people's families, peer groups and communities to build on those to create safety, rather than solely profiling those contexts and relationships for risk. And finally, the approach is used in a way that's rooted in a clear evidence of young people's lived reality, not relying on data sets, for example, on crime and reported crime to know where young people feel safe or unsafe, but engaging directly with young people to understand why they spend time in the places they do, what makes them feel safe or unsafe in those places, and what might make a difference, especially because we know a number of young people impacted by extra-familial harm won't be reporting it into formalised systems. So when we've taken that framework and applied it in multiple test locations, and we have 9 test locations at the moment where researchers are monitoring the progress of contextual safeguarding, we are seeing variations across those sites, but also some thematic kind of areas of development, things that they're all doing that are quite similar. And the way that we're testing contextual safeguarding is at multiple levels. So we have 10 pilot sites, 9 of which have researchers in them at present. 1 is closed down now, completed their work. They form part of a wider implementation group of local areas, of which there are 25, that meet 4 times a year to discuss their progress in implementing contextual safeguarding. Those 25 are part of a wider network of 54 areas in England, Wales and Scotland who have committed to a contextual safeguarding approach and who meet without the research team in regional groups across England, as well as a group in Wales and one in Scotland, to share regional learning. And all of that work feeds into strategic groups that we've formed to consider the implications of contextual safeguarding for policy, research and commissioning, including a UK advisory panel with representation from government departments across the UK nations, inspectorates and practice associations, an academics network to bring together researchers interested in this field, and a voluntary and community sector collective who are utilising the learning from the test work to develop contextual interventions. So there are three areas of learning I wanted to highlight for you in today's seminar. The first is that wherever contextual safeguarding is applied, we see professionals routinely consider which context presents the greatest risk of harm to a young person. And we call this type of activity context weighting. We see it embedded in various processes at the point of assessment, in strategy discussions, in planning meetings, conferences, review meetings. It helps a professional network identify whether the response they're proposing is targeted in the right place, and is often presented as an illustration. So in this visual, we see the school box being the largest, followed by the peer group, because the school was the context where the young person was most unsafe, followed by the peer group. What was happening in the family and the neighbourhood was less relevant to their safety at that time. So the group needed to consider whether or not their plan was targeting the school and peer group in a way that would create safety. And this has been really important because historically, when I would review cases, there'd be lots of information in case files on young people's peer groups, schools and neighbourhoods, and buried in case notes. And then the plan would be focused solely on the young person or their family and not target the context of most concern. The second thematic point of learning we see across test sites is a move away from everybody, safeguarding being everybody's responsibility, being interpreted as it's everyone's responsibility to share information and make referrals into children's services, and towards it being everybody's responsibility to create safe spaces for and around young people. So a school might refer 3 young people into children's services for sharing indecent images of other young people in that school. And there may be plans put in place to support those young people depending on their needs and wider circumstances. But the response might also focus on creating safety within the school environment itself, identifying whether this is a one-off incident or whether there have been multiple incidents of abuse through image sharing within the school, whether there are patterns within particular key stages, what the response of the staff is, and what might need to happen to create safety in the school environment to prevent ongoing incidents of this nature. And the third shared point of learning from our test sites is the contextual safeguarding is used at 2 levels. At one level, we see the contextualizing of work that already happens with young people and their families. And at a second level, we see responses to context themselves. To give you an example of this, I want to look at assessment. So at the first level, contextualizing responses to young people themselves, we see the introduction of activities like safety mapping with young people, asking them to colour code maps of their area, red, amber, green, where are their red zones, where are their amber zones, where are their green zones. And that happening during assessment in order to then inform the plan. So if a young person identifies a red zone and that red zone is somewhere where they need to travel to get to college or indeed to access a service, can a green person be identified for them in their red zone? Can they access a service in another location? And so on. At a second level, we might see a response to the red zone itself, particularly if multiple young people identify the same place as a red zone or there's a critical incident in the red zone. And in those situations, we've seen test locations conduct welfare-based assessments of the needs of young people in those red zones. What are the needs of that group of young people? What's the quality of the guardianship in that location? So who are the adults? Do they know and understand their safeguarding role? Do they have trusted relationships with the young people who are there, and so on? And what are the environmental and community factors that may be underpinning safety or risk in those settings? And those assessments being used to build plans for those contexts. And we've seen this work be brought together to build safety around young people who are at risk of significant harm. For example, in one of our test sites, a young man had been stabbed in a location that was already associated with violence. So a safeguarding assessment was initiated of the area where So a safeguarding assessment was initiated of that area, which involved engagement with residents, mapping of the local area, and surveying of local businesses to build an assessment of need, understand guardianship capacity, and identify any environmental or community factors relevant to safety in that area. The findings of that assessment were considered at a safeguarding meeting, in this particular site chaired by a child protection chair, and it resulted in a plan to establish an estate-based parental support group in the area, training on community guardianship for some residents and business owners who had put themselves forward for that, some property redesign work led on by housing, and the use of detached youth work to engage young people in alternative activities. And while this was happening, the young man who had been stabbed was allowed to remain at home with his family, prior to which there'd been a proposal to move him into a distance placement to get him away from the locality. And he said if he was moved, he would run away because he didn't want to leave his family. So this was an alternative offer for him. So what are the implications of us working in this way, applying the contextual safeguarding framework and some of the thematic learning from test sites in youth justice settings? Well, the first is it's important to note that the CS framework has been supported by leaders and researchers who have been reporting on young people who are both offending and are being victimised. So, for example, in the triennial review of serious case reviews in 2020, Brandon et al. Stated that in the case of adolescent community harm, it is not enough to work with individuals when a whole peer group is participating in harmful behaviour. Contextual safeguarding promotes awareness of vulnerability in the context of spaces where adolescents spend their time, for example, online, in parks, or at school. And in the same year, the Anti-Slavery Commissioner produced a report on child criminal exploitation, where they stated that in response to this, children's social care practitioners, child protection systems, and wider safeguarding partnerships needed to develop partnerships and engage with individuals and sectors who have an influence over and within extra-familial contexts, and that the assessment of an intervention with these spaces are a critical part of child protection interventions. So that wider narrative is starting to shift. And we see brief mention of it in our current version of Working Together, which was amended in 2018 in paragraph 41, a statement saying that children who may be alleged perpetrators should also be assessed to understand the impact of contextual issues on their safety. And this is part of a section which then calls for interventions to focus on addressing those environmental factors, which are likely to be a threat to the safety and welfare of a number of different children who may or may not be known to local authority children's social care. So we have authorisation and statutory guidance to move our lens towards context and the focus of our interventions, and that applies to children who may be open to youth justice services. But what might this look like? There are three things I want to highlight to you before I close my presentation today. The first is, and it's something I've talked about already, is introducing contextual thinking into assessment and planning. So when conducting assessments using Asset Plus, identifying opportunities to introduce language around context weighting, which contexts are ones in which this young person is safest, which are they least safe, and what might that mean for external and internal factors related to offending behaviour. Heat mapping could also be introduced to develop safety plans for young people, especially young people who may be at risk of not attending interventions and be breached because of that, because interventions are located in red zones. And in Asset Plus, there is a space to discuss young people's peer relationships. The peer assessment framework that was introduced as part of the contextual safeguarding test work may help in this respect. So when we're thinking about young people's peer relationships, recording information on how the young people's peer groups are functioning, what the guardianship capacity is around those peer groups, and what some of the environmental and family factors may be that are facilitating safety or risk within those peer relationships. And these are all things that we've seen in test sites where youth justice services are particularly involved, thinking about how they can integrate these practices into their assessment work alongside colleagues in children's social care who are doing the same. And in some teams, for example, we have a kind of integrated young people service that includes the youth offending service and a social worker around extra-familial harm and an edge of care team and an exploitation team. They're all in the young people service, and regardless of the assessment they're using, whether it's a child and family assessment, Asset Plus, or an early help assessment, making sure that context weighting features, safety mapping features, and if peer relationships are involved, the same language is used around peer assessment to gain some consistency in the service. We've also seen youth offending team practitioners advocating for social care responses to young people who offend. in the context of abuse, and in particular pushing social care to respond to context themselves. So in one of our test sites, a young person was arrested for possession with intent to supply Class A substances, and the youth offending team used their knowledge and understanding of extra-familial harm and their work to develop a contextual safeguarding approach in their team to successfully escalate concerns with children's social care, who had originally closed this young person because there were no concerns around parenting. But the team pushed again, and this resulted in recognition that while the young person was safe at home, they were at risk of significant harm in their community. And a plan was then coordinated by social care and involved safeguarding colleagues, the police and housing to put in place disruption tactics for the people who posed a risk of harm to this young person, to identify safe spaces or green zones for them to be when they were in the community, and to develop a clear and robust safety plan shared by the professional network to address the harm he experienced. A national referral was also made for this young person, which came back with conclusive grounds that they had been a victim of slavery. So what we saw in this type of example was a young person who previously would have been supported solely by the youth offending team without a safeguarding response to those wider contextual issues, then being supported still by the youth offending team, but with a multi-agency plan to address some of the drivers of harm and offending that he was experiencing. And finally, it's really important to think about opportunities to promote responses to contexts where young people are at risk of harm and offending. Indeed, in working together, there's a specific reference to youth offending teams being well placed to identify contexts where young people are at risk of harm, and then in panels and partnerships advocating for responses to those contexts themselves. In one of our test sites, numerous young people were identified by the police and schools as carrying and selling drugs in and around a local fast food restaurant. And in response, the restaurant had disabled its Wi-Fi connection. So young people stopped spending time at the fast food restaurant and instead started to spend time at the library, sometimes up to 80 young people being there after school. Complaints of antisocial behaviour in and around the library then started to increase, and there was a concern that young people were using and selling drugs in and around the library, and that some unsafe adults had been seen approaching young people in the library space. Some fights had also broken out in the library, and so the library had sought help from the local authority and the police about what they should do. A welfare-based assessment was initiated of the library. And as a result, a pop-up youth club was established in the library to co-create ideas with young people about how better to use the space. Training was also delivered to the library staff on bystander intervention and adolescent development to improve their confidence in forming relationships with the young people in the library and interacting with them. A one-to-one support was provided for a much smaller number of young people, less than 5 of the 80, from the substance misuse service. And the practitioner who led this response stated that responding to young people in this situation through a contextual safeguarding lens led to a decrease in antisocial behaviour and helped to form a stronger relationship between the young people and the library staff, which ultimately created a safer space for young people to socialise. This in turn has had a longer impact on safeguarding young people engaging in this space. This type of a response to a context aligns completely with the contextual safeguarding framework because it targets the context in which the abuse was occurring and harm through a lens of child welfare led on by children's services and the youth service in this case, in partnership with the people who could make a difference in the library, so the young people and the library staff, as well as the substance misuse service and the police were drawn upon to monitor any adults who posed a risk of harm to children in that space. And the outcomes were contextual. The partnership was focused on creating safety in the library rather than solely counting the numbers of children referred into additional support as a result of this intervention. We also see that this type of response to a context aligns with the values of contextual safeguarding. It's ecological. It saw this group of young people in the context of the library rather than labelling them as the issue. It was evidence informed, engaging directly with young people to understand why they were there and what they needed. It was collaborative, worked with young people and the library staff to develop solutions. It was strengths-based. It sought to create safety in the library rather than to displace the risk elsewhere or simply disrupt it. And it was rights-based. It sought to create an environment where young people could socialise together after school rather than forbid them to have contact with each other. So in closing this seminar, I leave you with the following key messages. Contextual safeguarding work requires us to move beyond disrupting risk and work towards increasing safety for and around young people. Contextual approaches can be integrated into a range of practice frameworks by individuals and teams, and that includes within youth justice services as well as social care. However, working at level 2, responding to contexts themselves, does require leadership buy-in and strategic direction for it to be embedded in services. National policy frameworks have started to create an authorising and enabling context for us to work in this way. And youth justice take-up of this approach can be demonstrated both in the internal actions taken by practitioners, for example, to integrate contextual thinking into assessment and planning, as well as external actions around partner engagement, for example, advocating for a social care response to a young person at risk of significant harm beyond their family home. I've shared many of these ideas in an academics insights briefing I produced for HMI probation last year, and may be producing a second one on contextual assessment for them early next year, so do watch out for that. But if you have any other questions on contextual safeguarding, there is a short TEDx talk you can access on this, a book that's been written, and a range of resources on the Contextual Safeguarding Network, including an implementation toolkit and a briefing on Asset Plus and contextual safeguarding that you may want to access. Feel free to get in touch with me over Twitter or by email and access all the resources on the Contextual Safeguarding Network. Really looking forward to the discussion now, and I will stop sharing my slides.